Welcome to Shalonda's Nursing Corner, your go-to place for nursing education and NCLEX prep and high-yield topics. If you're new here, don't forget to like, subscribe, and hit that notification bell so you don't miss out on future nursing content. As a nurse, you'll often have multiple patients with different needs. But how do you decide who to see first? The NCLEX loves to test your ability to prioritize patient care, and today I'm giving you the must-know strategies to ace these questions. The first rule of patient prioritization is the ABCs: airway, breathing, and circulation. If a patient has an airway obstruction, respiratory distress, or circulatory failure, they are your top priority. Example, a patient clutching their throat versus a patient with a mild headache. The choking patient is highlighted as the priority. Always think, will this kill my patient the fastest? If yes, take action immediately. Maslow's hierarchy helps us prioritize physical needs first, such as oxygen, food, water, and elimination, before addressing psychological or emotional concerns. Example, a post-operation patient in pain versus a patient requesting emotional support. The post-operation patient is prioritized first. Next, prioritize acute over chronic conditions. A sudden change in condition, like new confusion, sudden pain, or a drop in blood pressure, is more critical than a stable chronic illness. Example, a patient with new onset slurred speech versus a patient with controlled diabetes. The stroke patient is prioritized. Unstable patients always come first. Signs of instability include sudden change in vital signs, new or worsening symptoms, post-operation complications, active bleeding. Example, a post-operation patient with low BP versus a patient requesting a dressing change. The post-operation patient is prioritized. NCLEX also loves to test delegation, remember. RNs handle critical thinking, assessment, teaching, and IV meds. LPNs can reinforce teaching, give meds, accept IV, and perform sterile procedures. UAPs handle basic tasks like vital signs, feeding, and hygiene. Example, an RN delegating vital signs to a UAP but keeping assessments for themselves. Now it's time to test your knowledge. Try these NCLEX-style questions and check your answers below. Question: which patient should the nurse see first? A 60-year-old with pneumonia, oxygen saturation 88% on 2-liter oxygen. B, a 45-year-old post-op knee replacement requesting pain meds. C, a 70-year-old with a history of COPD, oxygen saturation 92% on room air. D, a 55-year-old with chronic hypertension and BP 140/88. Answer: A 60-year-old with pneumonia, oxygen saturation 88% on 2-liter oxygen. Explanation: this patient is experiencing respiratory compromise, which falls under airway and breathing ABCs. Oxygenation issues always take priority. Question: the RN is working with an LPN and a UAP. Which task should the RN delegate to the LPN? A, teaching a patient how to use an incentive spirometer. B, assessing a patient's pain level before Medicat ion. C, administering oral medications to a stable patient. D, assisting a patient with ambulation post-surgery. Answer: C, administering oral medications to a stable patient. Explanation: LPNs can administer oral meds, but teaching, assessment, and critical thinking must be done by the RN. Question: a patient with chest pain arrives at the ER. Which order should the nurse follow? A, administer nitroglycerin. B, obtain an ECG. C, give morphine for pain. D, assess vital signs. Answer: D, assess vital signs. Explanation: the first step in any emergency is assessment. Vital signs help determine if the patient is stable or unstable before giving medications. How did you do? Let me know your score in the comments below. If you found this helpful, like, subscribe, and share with your fellow nursing students. See you next time on Shalonda's Nursing Corner.